Hi, my name is Liz. I'm an OTD student, and I'm here today with Natalie, who will be acting as my client, and I will be showing you what the Semmes Weinstein monofilament test is. So to start, if you guys want to go to the PDFs, this is the screening form I'm going to be using for this first test, okay? Just for example, and as you can see, there's colors. So basically throughout this exam, I will be coloring the portions of the hand based off of what Natalie responds to and her sensitivity levels of her nerve. So the goal of this is to test the sensitivity of her peripheral nerves of her hand. So we will be starting distal to proximal, and we will be using what's called monofilaments. So as you can see, the colors on the monofilaments coordinate with the colors that I will be using to color in her hand. And this is a screening test, so there's only 5, as you can see. And each 5 of these have a different color. And at the end, right here, is where you can find the force. So this one is the maximum threshold level for the normal value, and that is 0.07. Now, if you were going to use the entire full 20-piece monofilament test, there would be more monofilaments that fill up this threshold, but this one's just the maximum level of force for this threshold. So now, Natalie, I'm gonna have you put your palmar side of your hand up, and we're just gonna do one hand just for the purpose of the assessment. So for our purposes, we're only gonna perform this exam on the palmar side of her hand. And like I said before, we're gonna start distally and go proximal because we're gonna assume that if the nerve is working at the most distal part of her hand, it's gonna work anything proximal that way. So you always start with the lowest the lowest grams of force. So we're gonna start with the green. And this is what the monofilament looks like. It looks like a needle, but it's not a needle. As you can see, I don't know if you can see it. It's kind of like a fishing line almost, okay? And that's what this number represents, is how big the monofilament is. And again, this one is the force. So that's what actually matters in this test. So as you know the hand, we are basically testing the different nerves. So digit 1, 2, and 3, median nerve, and then digit 5 is the ulnar nerve. But for the monofilament test, we're gonna be splitting this digit 4 up because the radial half is the median, and then the ulnar half is the ulnar nerve. So that is what we're gonna kind of analyze after we have the results of this test. So I'm gonna get started, and we're again starting with the lowest grams of force, which is the green. And I'm gonna go through, and Natalie is going to close her eyes for this exam. You can also use a blind or some type of screen so she can't see what I'm doing. And then we're gonna go through, and you're gonna make sure you're coming down on the finger at a right angle, okay? And you see how the monofilament bends? You want it to bend, so you wanna press until it bends a little, okay? So for this one, you're gonna press down 3 times on each finger. And Natalie, I'm gonna have you say yes if you feel it, okay? So if you could turn your hand over, and I'm gonna go through, your eyes are closed. Yes. Okay? Yes. Yes. Okay, so just for those 3 fingers, I'm now gonna go in. So that was her right palmar side of her hand. So I did the tip of the thumb, tip of the pointer finger, tip of the middle finger, okay? And so, like I said, because she could feel the green, I'm gonna color this in green, okay? So then now for the 4th digit, this is very important. Make sure you do both sides of the 4th digit because it's innervated by 2 different nerves. So I'm gonna do the median nerve side, yes, okay? And then the ulnar nerve side, yes. Okay. And then I'm gonna do the 5th digit, yes. Awesome. So I'm gonna finish coloring this in. So as you can see, Natalie, we're gonna go back to her chart. She fell into the normal threshold level. So Natalie's sensitivity would be normal for this screening exam. And that is the first one. And now we're gonna do a second one showing an alternative result.